Hi guys, welcome back to Dr. A YouTube channel. In this video, we are going to talk about arterial anastomosis around the shoulder joint. That means scapular anastomosis. Arterial anastomosis means branches of an artery are connected to the branches of another neighboring artery. That means it provides collateral channel for circulation when one of the arteries is blocked. So this scapular anastomosis takes place in two places. First one is body of scapula. Second one is acromial process of scapula. First, I will name the parts of this diagram. So here you can see the first part of subclavian artery. And this is the branch arise from this subclavian artery. It is known as thyrocervical trunk. And here you can see two branches arise from this thyrocervical trunk. So this one is known as deep branch of transverse cervical artery. And this one is suprascapular artery. And here you can see the axillary artery. After the subclavian artery, it continues as the axillary artery. And from the second part of axillary artery, the thoracoacromial artery arises. Here, thoracoacromial artery. So here you can see the acromial branch of thoracoacromial artery. And so this is the acromial branch of suprascapular artery. And these are the branches arise from the third part of the axillary artery. This one is the anterior circumflex humeral artery. And this is the posterior circumflex humeral artery. So here you can see the acromial branch of posterior circumflex humeral artery. And another artery that arises from the third part of the axillary artery. Here you can see the subscapular artery. And this is the circumflex scapular artery. And these are the intercostal arteries. So these are the arteries and branches that can be seen from this diagram. And now let's talk about the scapular anastomosis. The first one, anastomosis around the body of scapula. Here you can see the body of scapula. And this is the anastomosis around the body of scapula. So this scapula has a rich network of blood vessels that form an anastomosis, ensuring continuous blood flow even if one of vessels is blocked or damaged. Okay, so the first one is suprascapular artery. Here you can see that. And it originates from the thyrocervical trunk, which is a branch of the subclavian artery. And the second one is deep branch of transverse cervical artery. Here you can see that the deep branch of transverse cervical artery, and it also originates from the thyrocervical trunk, which is a branch of the subclavian artery. And the third one is circumflex scapular artery. It is a branch of subscapular artery which arises from the third part of axillary artery. So these three arteries form a network by connecting with each other through smaller branches, ensuring a continuous blood supply to the scapular region. So now let's talk about the anastomosis around the acromion of scapula. So this acromion is the bony projection of the scapula, the highest point of the shoulder. And the key arteries involved in the acromial anastomosis are, first one is acromial branch of suprascapular artery. Here you can see that acromial branch of suprascapular artery. So the suprascapular artery originates from the thyrocervical trunk, and it is a branch of subclavian artery. And the second one is acromial branch of thoracoacromial artery. Here you can see that the thoracoacromial artery, it is a branch arises from the axillary artery the second part of the axillary artery. So this is the acromial branch of thoracoacromial artery. Third one is acromial branch of, here you can see that, posterior circumflex humeral artery. Acromial branch of posterior circumflex humeral artery. So these are the arteries that involve in the anastomosis around the acromion of scapula. That's all about anastomosis of scapula. First one around the body of scapula, and the second one around the acromion of scapula. And if you want to know about the axillary artery and its parts and its branches, you can watch the video in my YouTube channel. So that's all. Thank you guys.